So the concept of regionalization of care for a child with congenital heart disease is pretty well advanced in other parts of the world, certainly in Australia. But regionalization of care is not so prevalent in the United States. At the same time, our search committee was very intent on finding a new cardiac surgery chief who was collaborative in their practice. Tell us how you view collaboration and regionalization of care in the Washington area in particular, and really around the country.
It is difficult to be in my position and not to speak for centralization of care. There's obvious data that if you do more patients in one big centers that is providing specialized care, you're going to have better results, especially in the high-end complexity cases. And that's what I want. People in my position, with my type of job, want to have regionalization. In my training, though, I have worked in scheme where smaller centers were doing good work and could work in collaboration with other centers who were doing more specialized care. And I think that this model can work. My vision is that you get a lot more by collaborating than by fighting each other. I don't see myself as competing in any devious way with any neighboring institutions. I know, and I hope that I will inspire that by being collaborative, everybody gets more than by working individually. And I found that with the Australia-New Zealand Fontan Registry, that's a registry that I create, the largest database of single ventricles, so the most complex heart disease patients in Australia and New Zealand. That initiative put together all centers from Australia and New Zealand and all the pediatric with the adult centers. And everybody individually got a lot more by working together. And that has been my model. It's a question of personality as well, I think, and I hope. I think that if you have good relationship between people, the people will understand, be less fearful to be stolen something, and then working together. I hope that then I can inspire that. When I talk about collaboration, there's regional collaboration, but if I may say, there's something interesting that's happening in North America now, I think, is that the first generation of pioneers were defending their turf, and there were different vision, different views, and there was a lot of fights. This is changing now. We're in a new era. The new generation of leaders in the field in pediatric heart surgery know each other well. We're not in this fight mood. And I think that, grossly speaking, in North America, and that will rain down to more regional centers as well, there's a much more collaborative spirit than 15, 20 years ago. I think we'll see changes in North America, and I want to be part of that.
And I think from our hospital point of view, we are truly committed to collaboration in the region and to think of ways that we can work with other congenital heart centers and other congenital heart programs to make sure that the patients are allocated in a fashion where the best outcomes can be achieved. And through collaboration, we seek to improve outcomes and improve the care, keep it close to home, and make sure that we keep the patient and the family at the center of our decision-making.